let's talk about health, because the Ghana Health Service, through its neglected tropical disease program, will be embarking on a nationwide mass drug administration to eliminate elephantiasis and onchocerciasis. That will be done in about 125 districts across the country, which are endemic to these diseases. That's parts where these diseases are endemic. The distribution will be done by well-trained community volunteers or community drug distributors who will be moving from house to house to administer those drugs. Dr. Kofi Mafo is Program Manager of Neglected Tropical Diseases Program under the Ghana Health Service. He joins me now in studio to tell us a bit more about this program. Dr. Mafo, thank you very much for your time.
Most welcome.
Okay, so that big disease that I almost I almost mispronounced. We know a bit about elephantiasis, and we know about this. Is it a bite by a fly? Did I get it right?
Mosquito.
Oh, by mosquito, a specific.
Yeah, Anopheles mosquito.
Anopheles mosquito.
The very vector that, so to speak, transmits malaria. Okay,
so having spoken about my ignorance, tell us a bit more, educate us a bit more on these diseases, and to what extent are they even prevalent?
Yes, so thanks a lot for the question. Basically, elephantiasis, as I said, is caused by a tiny worm transmitted through the bites of mosquitoes. Okay. And the same applies to Onchocerciasis. Well, the worm for elephantiasis is what we call Wucherella bancrofti. I hope it's not a big word for you.
No, forget about it. Let's move on.
And then we have, there's another worm also called Onchocerca volvulus. Also that also, so to speak, is the cause of river blindness. So we talk about elephantiasis and river blindness.
River blindness.
Yes.
Okay, so river blindness, we know that there are very bad sources of water. Just this afternoon, we've done a story about a very dirty source of water that people use. Has it got anything to do with the generation or the beginning in the spread of this disease, river blindness?
Yeah, but so river blindness is basically caused, as I mentioned, by a worm, but transmitted through the bites of the black fly.
The black fly.
Yes, not the mosquito, but the black fly.
Okay.
And the black fly, normally, you find black fly along fast-flowing rivers. Yeah. Yes, and that's where you find the black flies, and then they are able to reproduce. And you have the larvae that also grow into adult ones.
To what extent are they prevalent? If you take
if you take elephantiasis is endemic in 8 out of the 10 regions. I'm talking about the 10 traditional regions. I'm not talking about the 16, but 8 out of the 10. Yeah. So except for Ashanti region and the Volta region, in terms of the endemicity. Now, for Onchocerciasis, it's endemic in all the regions except for Greater Accra.
Except for Greater Accra region.
Yes.
And so, what is this plan? Tell us about this grand plan to help deal with it somehow.
Yes. So, what we are going to do, and that's what we've been doing annually, we'll be moving. So, in these very regions, we'll move into the endemic districts of these very regions that I've mentioned. 8 out of the 10 regions for the elephantiasis, and then 9 out of the 10 regions for river blindness. And then we have the volunteers who will be doing house-to-house administration of the drugs. Yes,
so these
5 years and above.
Okay, so 5 years and above. Tell us how these drugs are going to work. Are they going? Is some sort of vaccination?
No.
Okay.
There are drugs that will take orally.
To prevent?
To prevent and also to treat in case you even have the worms in you.
How do you know if you have the worms in you?
You wouldn't know. That's why we are doing this sort of what we call the mass drug administration. Wow. Ideally, we could have gone ahead to do a test to know, but that is that would be quite difficult to do in terms of public health. Yes, so we move from house to house and then we give drugs.
Okay, when does this start?
So it kickstarts from this very Monday.
Monday, next Monday.
29th of this month.
And it's going to happen for how long?
For 2 weeks.
For 2 weeks. So it starts from next Monday and it stays on for 2 weeks.
2 weeks.
In all the regions except Volta region.
Volta region and Ashanti region for the elephantiasis. And then for Onco, all regions
except Greater Accra region. So people should be expecting volunteers coming to their homes and asking them to allow them to administer these drugs to their children who are 5 years
and above.
5 years and above.
Yes.
And are you free to object if you don't want it?
Yes, you are. You are free, yes. But we will advise that all will participate.
Okay.
Because as we take the drugs invariably will kill the worms. If you have worms in you, kill the worms so that you will not develop the swollen legs that we've been seeing around.
Okay. Well, Dr. Mafo, we wish you all the best for this program, and we really hope that it goes down well to protect people from all these two diseases that you've mentioned. Your final words, if you have any.
Yes, my final word is that I wish to advise the general populace to participate in this very important campaign, so that together we'll be able to eliminate these diseases.
Do they come with an ID? Because these days,
some will not. It depends, because we have provided ID cards in some of the areas, but not in all.
But not all the areas. Okay, so am I sure that?
Yes, so the volunteers normally they are known by the community members.
Okay.
Yes,
so
they normally.
So people from the community.
Yes, the volunteers are normally selected from.
Okay.
From the
so from next Monday, the Ghana Health Service, through the Neglected Tropical Diseases Programs, is launching an administration of drug program where they're going to be doing this for 2 weeks. They'll be coming to your home in all of the regions except Greater Accra for Onchocerciasis, river blindness, and then Volta region and Ashanti region for elephantiasis. So when they come to your home, be open to them, be accepting of them. The volunteers are really people from the area. Doc, thank you very much for coming.
Most welcome.
Dr. Kofi Mafo is the programs manager for the Neglected Tropical Diseases Program under the Ghana Health Service.